There is a link. The data are pretty poor. The link is not a direct link between sleep and breast cancer. The link is indirect. So we know from a lifestyle standpoint that people who do not sleep enough and people who have poor quality of sleep can have some disturbance in their hormones. And the types of disturbance that they can have can give rise to insulin resistance. Now, you've heard of that. Insulin resistance is sort of like a pre-diabetes condition. It's associated maybe even with some increased weight. And these are the factors that correlate with the prevalence and incidence of breast cancer when they look at big bodies of data. And what you should take home from that is that if you recognize you're having some problems with sleep, either before a diagnosis of breast cancer just to be healthy, or after a diagnosis because it can impact the clinical course, there are some interventions to help out.
So let's ask the tough question. What is inadequate sleep?
So from a quantity standpoint, it's about 7 hours plus or minus. And really that's something that you can do. And there are some tips to help you sleep. I'm going to give you just one tip. How many people worry, and as a result of worrying, would say that they don't sleep well? Many people? All right, so only a few. So one of the tips would be to schedule worry time. Right? Sounds kind of weird, but it works. There's evidence. You schedule worry time. You allot a certain amount of time during the day, maybe in the afternoon or the early evening, kind of lock yourself in that room of yours, and you get a piece of paper and you just worry. You just worry and worry and worry. And after about 30 minutes of worrying, you're done. And people tend to sleep better.